Hi, I'm Gordon Bonnyman. I'm a lawyer with the Tennessee Justice Center in Nashville. We're a nonprofit public interest law firm. We serve people throughout the state, and among our responsibilities is advocating for people who are on Tenncare. We have been involved in several lawsuits with the state over the years, and the one that is of immediate concern is a case called Daniels that actually dates back many years. And the Daniels order protects people who, at some point since 1987, received SSI, Supplemental Security Income, based on their age, disability, or blindness, the great majority because of disability, and who subsequently lost their SSI. The federal regulations have always required that when states cover people who are on SSI and they get word from Social Security Administration that they're no longer eligible for SSI, they can't just automatically cut off their Medicaid, or in Tennessee we would refer to it as Tenncare, without checking to make sure whether they're eligible under any of a number of other possible Medicaid categories, conceivably as many as 40 different categories. Tennessee wasn't doing that in 1987. When they got word from Social Security that somebody was no longer getting SSI, they automatically cut them off. The federal court said, you're violating the rules. Don't do that until you come back to me with a process that assures that you can accurately determine whether they are eligible under one of these other categories. That was over 20 years ago, and for the next 2 decades, 4 different governors and their administrations looked at the order, looked at the process, and concluded, we don't want to try to cut these people off. We don't want to try to redetermine their eligibility for several reasons. One is that we don't really have good information about them because they came to us through the Social Security Administration, not through a state agency. So we're dependent upon the federal government for information. To get in touch with them requires the Department of Human Services, the Tenncare Bureau, Social Security Administration. It's really a very difficult administrative process. We know that by definition, all of these people have been found to be very needy at some point by Social Security Administration. The fact that they're no longer getting SSI doesn't necessarily mean that they've suddenly gotten well or become under 65, ceased to be blind, or inherited a fortune from a rich uncle they didn't know about. Mostly it's people who have become slightly over the income because they've received Social Security pension benefits that may well still be below the poverty level. So the judgment was made for 20 years. These people have severe needs. Many of them are going to be eligible under some other category at the end of the day. It'll be very costly to us and risky to them to try to get them through this administrative maze. And most importantly, in some ways, is the fact that we were drawing down $2 of federal funds for every dollar that's going to care for a population that has very severe medical needs by and large. And why have that burden fall just on the state, its health care providers, without getting that federal aid? That was then. Now, though, the state's position has changed, and last year the state asked the court to approve a new process, and in January of this year, with the backing of the outgoing Bush administration in Washington, the federal court here did give permission to the state to go forward, and it lifted the court order so that those people who were protected by Daniels, some of them having just lost their SSI last year, others as long as 20 years ago, they're no longer protected by the Daniels order. So the state is moving forward. The first batch of notices will go out on May 1st, and over the next 2 to 3, 4 months, everyone in this class will get notice, and they'll have to go through a process of proving that they remain eligible. This is very, very dangerous to that population for a couple of reasons. First, the process is going to be extremely daunting. It will begin with people getting a 7-page so-called peach form based on the color of the form. It's also known as an RFI, request for information. For those who lived through the Tenncare re-verification process 4 years ago, you may remember with considerable anxiety what that process was like. And this is going to be that same process. We know from experience 4 years ago that almost no one made it through that process and kept their benefits. There are, to give you some idea of not only how tough the process is, but how vulnerable this population is, just a couple of statistics. First, 18,000 of there are about 150,000 people who are affected, and which is roughly comparable to the number who initially lost their Tenncare coverage 4 years ago, with a tremendous impact across the healthcare infrastructure of the state. And like that group, these are not just any 150,000 randomly selected Tennesseans. They've been found in most cases disabled. They typically have a lot of chronic illness. The actuarial studies done for the Tenncare program show they are a very costly population. They consume $1.2 billion in services a year. So that's $1.2 billion, up to $1.2 billion that could come out of the healthcare system over the coming months.